is our RockBlade here. So this is just another way, instead of decompressing with the cups, this is some compression on the tissue, but not a ton. So we're gonna go at about a 45 to the body. And I'm just gonna kind of do a few passes along and just continue that warming of the tissue and increasing of the blood flow. I'm not trying to cause any bruising here. I'm just increasing the blood flow and kind of doing a survey of the land, right? So just like I did with the cups, I found some tight spots. I can do that with this as well. So I've got a spot right in here. So I'm just gonna hold that spot and then come to the edge. Hopefully you can see this. And what this is nice for doing self-massage, because if I was doing massage on you, I would just hold that with my hands or my elbow. It's hard to get that leverage on yourself. So I've got a spot right there. It's kind of like a speed bump. As I go up, it's like ba-dunk. So I'm gonna hold it there and then I'm gonna flex and extend. So I'm extending here. I'm gonna flex through. We're just gonna do about, I don't know, 5 or 6 of these pumps here. Now the first 2, my knee was popping. So I know I've got some tracking issues in my patella after my ACL surgery. And now it's not popping anymore. So some of that tracking is because my quads get tight. And if you watched my squat form yesterday, you'd see that my quads were tight and so were my ankles. So that's why we're also going to do some calf massage today. All right, so then I can also get in on that spot and kind of go all directions. So see which way it's not wanting to move. So it kind of puckers on the skin there. So again, I'm getting through the skin tissue, through the layers of fat, and into that muscle. But there you've got layers of fascia all in between, and so those fascia can kind of pull and bind. So we're trying to figure out which direction that fascia is kind of stuck and preventing motion. And I think it's kind of this direction. So I'm just gonna work it in that direction and try to free up some of that motion between the fascia and the muscles. And we got the IT band coming down here too. Okay, so hopefully you're doing this with me and not just watching, because it's pretty boring if you're watching the video. But otherwise, you can always come back to this video and kind of see what we're doing. All right, so now as I come down, I'm just trying to get my IT band to come off of my quad. So you can kind of see some separation now. Before I wasn't able to do that. And it was pretty locked in tight in this area. It still is a little bit, but it's feeling better to me. Okay, so I want to continue to open up and bring blood flow to that area. So I might continue to massage for a little bit here. Ideally I'm going towards the heart, but you know I'm going away because of the angle that I'm working on. And then I'm just going to go over that IT band. So working the muscle in all the directions. So you're freeing it in all vectors that the muscle is attached and working with other muscles around. All right, quads nice and red now.